and I welcome you all uh, as you have been following every week. Thank you for joining and listening to this update. And as always, still true that this information is true as of today. So things might be a little changing every day, and we'll catch up on those this week and next week and after. So, and here is the worldwide picture. And you can see that cases in hundreds of thousands to millions and within a year. And now since March 31st and April 7th today, we have, increase in the cases, about 5 million, I would say, and the deaths about 70,000 worldwide. And let's see, the US, we have about 400,000 new cases, and so about 6,000 deaths. And you can see the rise is still there. So we have to be more cautious, get it controlled, don't feel that we have a grip yet on this. And this is what's happening in Wisconsin and Columbia County. And we have 640,704 in Wisconsin, and Columbia County 5598. And the deaths are 7,349 in the Wisconsin and Columbia County. I'm happy that there was no death in the last week. So which is a very good sign. So we had the same deaths as last week. So if it stays good, and it will be very good progress and control. But at the moment, there is some variants. They are coming in Wisconsin, and I'll show you the data in a minute. This is New York Times update as of today, the new cases, and you can see that 7-day average and 14-day change is still little bit up here. So at the end, it's still, this is variants or reinfection, and so we have to be concerned with that rise of 19% in the last 14 days. And these are the new reported deaths each day. And there is a 7-day average here, the graph. And as we all know, that the holidays, November, December, January, February, we had the highest numbers. They peaked down. Then there was a relaxation of the methods to control, and the we went up. And then we also had variants infections. So, but there is a decline in the death rate, which is encouraging. And here is the problem with Michigan. And so what's happening there, that the new cases are as high as it was in December. So you can see the peak here. And this is related to the altered behavior of the virus. So it's a different mutation now. And here is estimated share of cases are from B117, and 75% of infections are due to variants. And here we have the numbers, cases of variants of concern in the United States. You can look at the Michigan and Wisconsin is lower number, but here is Minnesota and California and Florida and up in the east. So those are the dark blue states where we have high number of variant infection with B117, and it's spreading. Why is B117 more transmissible? So why it is transmitted more in the people. And there is a study at Yale and Harvard and Duke and UNC and Columbia that question was, could a higher or more sustained viral burden in the nasopharynx in B117 infection explain increased transmissibility compared to non-B117 strain? Can there be a lot of concentration of the virus in the nose and the throat and the pharynx? So that was the question. 65 patients with COVID-19, 7 with B117 did daily self-PCR testing. Proliferation time and clearance time. Proliferation time is from the first viral detection to peak viral concentration. So if it is right here and it goes up like that, and when it goes up, that reaches the peak, that is proliferation time. And the clearance time is just the downward peak to the previous level from the peak. So that's the clearance time. So they studied that. And here is the result. On the B117 and non-B117, which is COVID-19 or 2 infection, as we knew in the past year. So proliferation phase, the initial time to climb up to the highest concentration of the virus is 5 days, compared with 2 days with normal, coronavirus. And the clearance phase is also longer, 8 days instead of 6. Overall duration of the infection is 13 days as compared to 8. So the peak viral concentration is not much different in both cases, but here is the result. So what happens, the conclusion is B117 may cause longer infection with similar peak viral concentration compared to non-B117. So we have a longer infection with the variants. And this could explain increased transmissibility of B117. Now, this was a one study, but they're looking at the data from more studies, and we will have a better information coming maybe next week or so. So you should be aware of that. And this is Pfizer 6-month efficacy data after giving the shots, press release April 1st, results from 46,307 phase 3 trial participant, analysis 927 confirmed symptomatic cases of COVID-19. So 91.3% efficacy, 7 days to 6 months after the second dose. So after the second dose, the efficacy was confirmed by tests that there's 7 days to 6 months, these are protected. So 100% effective in preventing a severe disease and 100% effective in preventing COVID-19 cases in South Africa, where B1351 lineage is prevalent. So that means that Pfizer vaccine is also helpful in the variants, so which is a good thing. And so is Moderna. They're claiming the same data, similar data, And so hopefully people who receive these vaccine will prevent them from having a variant infection, or if they did, it will be milder. So the AstraZeneca had more troubles now, and it is mainly associated with what it started with, blood clots. And these blood clots event associated with low platelets. People who have low platelets to begin with, they got that. And how many got it? Very little percentage. Great Britain reported 30 cases of clot following AZ vaccine. 22 out of 30 was brain, uh, cerebrovascular clots, and they got a stroke. And Germany stopped AstraZeneca under 60 who got first AC dose. Canada stopped use of AZ in anyone under 55. So they're not using it. And Netherlands stopped use of AstraZeneca in anyone under 60. So why there's a difference? I think these are different studies. They got data from under 55, they got data under 60. So their criteria were different. Scandinavian countries still pausing the AstraZeneca. And the risk is low, 1 in 600,000 doses in Britain. So it's pretty low, but one should be aware of that if you have low platelets, risk is there. And CDC changes list of medical condition conferring risk for severe COVID-19 infections. What is not included here is, controversial, but asthma is one, which can be a risk factor, but definitely cancer, cerebrovascular disease, kidney disease, lung diseases, diabetes 1 and 2. Previously, they had only diabetes 2. Now I think they added 1. Heart condition, failure, coronary artery disease, obesity over 30, but they also included now BMI over 25, which is overweight. So overweight and obesity both are indicator for higher risk. And of course, the smoking, pregnancy, Down syndrome, HIV, and dementia, other lung diseases, sickle cell disease, it causes clots and things, blood stem cell transplantation, substance use disorder, steroids, and immunosuppressive. So those are the conditions which have a risk for developing severe disease. So good thing that they should get a vaccine and be protected. April 2021, 4 million doses per day. That's the target. We are somewhere on 3 million. And I think by the end of this month, we will reach 4 million. I think the promise was 1.5 million. If we reach 1.5 million, we will be able to achieve our goal, which is to develop herd immunity. We'll talk about it. So, but I think we exceeded that, promised little, but done more. So, which is good, make people happy. We are happy. They get 4 million, that's perfect, So a good operation going on. A lot of places you can get the shots, and waiting period is going down. The hassle, the older generation had difficulty in having access to make an appointment. That's become easier. So there's a lot of improvement there. This is about herd immunity. Let's think about that right here. You know, what is the herd immunity? If the population has an infection, antibodies due to the infection, or they received the vaccination and developed antibodies, these are all contributing towards herd immunity. And herd immunity is when the population reaches a threshold 70 to 85%. If people, 70 to 85% of the population either got the shots or developed infection and had antibodies, will cause immunity up to, so for prevention. So we're clear on that. So Gallup poll estimates that roughly 65% of the population is willing to receive a vaccine. So if they're willing 65%, we have a gap. And that gap may be the children, because there was no vaccine for children. And there are a lot of population, 25 million or so. And in that group who could benefit from these shots to bring the herd immunity to the level where it's needed. So encourage everyone to go out, have a shot, and develop a resistance and antibodies to the infections. So here is I think these three lines indicate just the shots only, or infection only, or shots and infection. So it's a combination, but the difference is between June and October. So if you have all the three, the June is the earliest we will have herd immunity. And I'm hoping that we achieve 80% by June. And so we will be a little more relaxed in getting out, and all the measures we are taking could be relaxed. So that's an important curve, and hopefully we're going to reach there. So even if we don't, we are somewhere here in August and September. It will be before the next winter. I think we are in a good place. Okay, let's see the next one. Herd immunity again. Till that time, we got to wear the mask and physically distance, and especially from unvaccinated people, and multiple households. If you have a family gathering, a lot of people coming, wear a mask, and keep physical distance in public, and avoid the medium and large size crowds and poorly ventilated public spaces, and wash hands frequently, and get tested if you feel sick. So it's pretty, common, which has not changed much. And this is if you're fully vaccinated, indoor without mask, or physical distance. You all getting together, no need to wear masks. You're not going to infect anybody, and they're not going to infect you. So they got antibodies, you got antibodies. And visit indoor with unvaccinated people from single household without mask or physical distance, if the unvaccinated people are at low risk of the severe disease. So you can meet them and we still, not wear a mask or uh, without physical distancing. And skip quarantining and testing if you're exposed to someone who has COVID-19 but are asymptomatic. So, but if they have, of course, symptoms, then you came in contact, you watch it out for 14 days. Children, we have Pfizer, which is tolerated 12 to 15 age group. They could be vaccinated by this fall. And they are also working on age group 5 and over. Johnson and Johnson, children can be vaccinated junior and senior in the high school, 17 years. And it is coming in September for neonates, 6 months to onwards. So that will be Johnson and Johnson. Moderna and 18 and older, but they're having a trial now, which is age 12 to 17, and they plan to enroll children ages 6 months to 11 years. So by September, you will see a big change in here as well. If they come early, we have a herd immunity before. Excellent idea. And how many people get side effects from this? Very low, about 10 to 15% of immunized volunteers develop noticeable side effect. And 15 to 30 minutes afterwards, the waiting period after the shot, to make certain they're not having anaphylaxis. It's very uncommon, but that's the most dangerous reaction. And history of anaphylaxis, if you have from other reason, stay for 30 minutes after vaccination. And more than 150 million doses of vaccine had been administered by the end of March. So far, there's no evidence of any death caused by COVID-19 vaccine. So that's very encouraging, of course. Chronic COVID syndrome, a recent study found that 30% of the people who had COVID-19 still had symptoms up to 9 months after infection. So that is chronic COVID. They have body aches, they may have respiratory problems, they may have aches and pain, joint pains, little shakes and things like that, but they don't have much cough. And so you got to be, aware of that chronic COVID syndrome can happen. And treatment, of course, I presented this last week, resting, exercising, keeping up with the nutrition. So I won't spend time there. COVID-19 and vaccine in children, we did talk about it, the other slide. And children usually under 12 who get COVID, they have a mild symptoms. And teenagers seem to have responses somewhere between what adult and younger kids have experienced. So 12 and under, very mild symptoms. 13 to 18 or older age group, they get in between symptoms between children as well as the adults. Teens were about twice as likely to be diagnosed with COVID-19 as children ages 5 to 11. So their chances of getting is more. And Janssen COVID-19 vaccine to prevent COVID in individual 18 years of age and older under an emergency use authorization. They're working Pfizer over 16. We talked about that. This is vitamin D. It plays a role in immunity, and it's already recommended that everyone in the UK take the supplement in the winter. with those at higher risk of vitamin deficiency advised to take it all year round. So that's the recommendation in United Kingdom, where the cases are extremely high and the death rate is pretty scary, as well as restrictions on movements are unbelievable. So they're recommending that vitamin D helps the immunity build up. No harm in taking it, and so might as well. Usually people get deficiency because they are not in the sun or some other autoimmune disorder. Let's see. This is you say yes to COVID test. It's a household test, and there's counties in Pitt County, North Carolina, and Chattanooga, Hamilton County, and Tennessee. 160,000 residents across the two communities will have access to free rapid antigen tests that they can administer themselves to use 3 times a week for 1 month. So they're going to do this experiment to see the rate of infection and type of infection and age group and distribution according to these county population. So, this is the end already, huh? Not bad, huh? I will go to questions if you have any.
I got on late. I got the Moderna vaccine, and I saw today that Moderna made a statement that they know that the vaccine is good for 6 months, for sure. But with Pfizer coming out first, and then Moderna, and then Johnson & Johnson, how are we all going to get to a place where if we have to get a booster, are they are they doing any focus on that yet?
They, I think you're correct. The readings are that 6 months, anywhere from 3 months to 12 months or 15 to 18 months. But that's what I have heard. But I think the average, every infectious disease doctor is saying is about 12 months. So I think it will be safe for us to not run for a booster. And the booster, they haven't recommended yet, but when they come, most likely is going to be 1 or 2 shots again, most likely 1 shot, and it will be improved vaccine. It may or may not contain the variants as well. So I think we're going to see that in the next, this is April, and we got 8 months to go. So we're already getting data, which I presented 6 months post Pfizer vaccine, that it is 100% effective in preventing and also in control of the disease.
Gotcha. I just thought, you know, how we're all on a cycle to get the flu shot. I'm like, how are they going to get us all on the same cycle? You know what I mean? It's confusing.
Yeah.
Confusing.
Yeah. The flu shot vaccine recipients are lower, and this year, I think there are several reasons, and we are focusing on COVID, and which is much more serious illness, and people are afraid to go to the hospital, have a test, and they're scared that it may be COVID, and though the symptoms are a little bit different. And the other thing is that wearing a mask and doing a social distancing reduce the spread of flu, and flu-related pneumonia or complication admissions to the hospitals are way low.
Yeah.
Good evening.
Can they hear you?
Can you hear me, Doctor?
Of course, yes.
Good evening, everybody. Thank you, Doctor, for having this Zoom meeting tonight. I appreciate it.
Yes.
I have a question that I believe I have the answer. I am one of many organizers for an annual community event that's very popular in our community. Our community is neighboring to Cambria. The event attracts thousands of people for a one-day event, and it brings in people from all over the state of Wisconsin. And when I say all over the state of Wisconsin, I mean every angle. And it brings in up to 4 states for a one-day event. I think I know the answer. I've been working close with the Columbia County Health Department. What would you say to me as an organizer presenting the event in September? It's always the Saturday of Labor Day weekend. I am the #1 organizer, and I've been getting calls about, oh, things will be more relaxed then, go for it. But
Okay.
I just would like to ask that question and see what your feelings are on that, Doctor.
Very appropriate and interesting question. And I will explain to you by giving an example. In Texas, they just had a gathering of thousands of people outdoor in the stadium situation. And there were, I wish I had the slide, but I didn't present it. Only 2 people were wearing the mask. Now, 2 weeks from now, they will find out whether people got sick or not. But our purpose with your purpose is not to do that experiment. So the recommendation would be, is this event is outdoor or indoor? Because
good question. Yeah.
Yeah, go ahead.
Good question, Doctor. It's outside, but our fear is that we will not be able to social distance the people. And of course, some will choose not to wear a mask, and it would be hard for an organizer to enforce that.
Yeah.
6-foot distancing. And we also have food, and it's just a busy day.
Okay, so do you have alcohol outside?
No, sir. Our event is alcohol free.
Okay, so that means it's not that people don't converse when they have a beer or something. They get closer and converse in a group way. But here you're talking about 1,000 people gathering outside in a large area. So #1, you can advertise that they should all be vaccinated. If they're all vaccinated, it's great. If you don't get that response, they're vaccinated or unvaccinated, if you can make a partition there, a little ribbons type, all vaccinated on one side and unvaccinated on the other side. So vaccinated could mingle without mask and without social distancing. Unvaccinated, as I have explained, they should wear a mask and do the social distancing. If they cannot do the social distancing, limit their time to 15 minutes. So they should not be exposed more than 15 minutes to a unmasked person. And with the masked person on both sides, unvaccinated, I think it is better to have a double mask. So that if you can do that, of course, the eating time, they have to remove their mask, but they can definitely go a distance. So you can either put chairs or their seating arrangements at least 3 feet apart. So that will work very well. And so does that answer your concerns, or any other thing in there?
Yes, doctor, thank you. You shed some light to some things that we have not thought about. But again, I've been working very closely with the health department. And when we have the attraction of up to 4,000 people with hardly any walking distance in the event,
Area.
it just doesn't seem possible that it's doable for this year
Yeah.
again. So
But you can definitely do there, vaccinated and not vaccinated. They don't have to wear a badge. Just on the grounds, you can have vaccinated people, please confine to this area. And unvaccinated, offer them a mask and they can confine to that area.
yes,
And,
very good, doctor.
right? And if you want to mingle with them, limit it to 15 minutes. If somebody's going to talk about it, make a speech, put it to 15 minutes.
Okay. Thank you so much, doctor.
Okay, you're welcome. Very good question. Yes.
Thank you.
Okay, that looks good. And it's almost dinner time and let's retire, right?
Doctor, could I just ask one more question before we
Sure.
all go?
Sure, sure.
I caught the slide. I came in when there was a slide that had 70 to 85% of herd immunity could be reached with what you had spoken about if people get their vaccines by June. Is that what we're thinking, that we are going to reach herd immunity with 85%, 70 to 85% by June?
I think the real fact is that I talked with the infectious disease epidemiologist. They said if we have like a 4 million shots as we are planning on, those that they are giving how many right here, 4 million a day, will catch up and we will have herd immunity by June. But if we fall short and we have some other unknown circumstances pop in, then we will be in October. But definitely June is the target. And if we get 70%, that's where the herd immunity threshold starts. And then 85% is the top. So, I don't think we're going to get 90% or 100% vaccination. So if we reach 80%, we are very, very good. And 85% is excellent. We will not be topping 85%.
Okay, then the question, then we reach herd immunity because people are having their vaccines. So where could you shed some light on what would then be with the variants that we're getting? That there would be no room for them to mutate then, right?
Yes, there will be enough people and to have antibodies, so they will not be infected and transmitting, or they will not be causing a change in the virus structure in any way that virus says, okay, I don't like this person, I'm going to infect it, and change and infect the uninfected person, and may have a variant, mutation on it. So that will be reduced. The risk will be reduced. And vaccination, the Pfizer and Moderna, they're working on the, present vaccine also works for the mutants. And the third shot may come, but I don't think third shot is going to be given at this time to develop the herd immunity.
Thank you.
Bye, everybody. Thank you.
Yeah.
Thank you.
Thank you.
Bye. See you next week.
Thank you. Thank you.
Thank you.
Dr. Samadani.
Thank you. Wonderful.